Hello, my name is Rebecca Woodson, and for my presentation today, I will be comparing the healthcare systems in Scotland and the United States. Scotland holds a special place in my heart after I studied abroad there in May of 2016. I spent most of my time in Edinburgh exploring the different cultures and all of the diverse people that reside in Edinburgh. So one of the main things that I noticed there was that their architecture and just the feeling is kind of set back in time. So this was really something that intrigued me, and I really wanted to compare the two healthcare systems because healthcare is my chosen career path, and the healthcare system is something that I will be working with on a day-to-day basis when I do become an occupational therapist in the future. So to begin, I just wanted to give you a couple facts about Scotland so that you'll better be able to understand when I compare the two. So Scotland's population currently sits at about 5.295 million people. The United States is currently at 323.1 million people. So as you can tell, that is a ginormous difference in the population sizes of these two countries. So when I will be doing my presentation, I will be taking all of these populations and either changing them to percents or to ratios so that we can compare the two much easier. Also, Scotland is a part of the United Kingdom, which is made up of Scotland, Northern Ireland, England, and Wales. So some of the information that I will share will be on the scale of the United Kingdom, such as the accrediting body, which we will talk about here in a little bit. Lastly, Scotland's currency is the pound sterling. So any of my topics that cover monetary values, I have gone ahead and converted pound sterling to dollars, just so that we can again be able to compare them more easily. So without further ado, I will be discussing different topics such as population health, physical environment, the social environment. So I will be beginning with population health and infant mortality in particular. Infant mortality really focuses on the beginning of life, and infant mortality deals with children that die before they reach age 1. So infant mortality here I will describe per 100,000 people. So as I said earlier, I will convert these populations to ratios. So here, in the United States, 852.1 million children that are born per 100,000 children that are born will suffer from infant mortality. In Scotland, 370 children that are born of 100,000 that are born will suffer from infant mortality. Looking at these two numbers, you can see that there is a huge difference. Over 200 children in the United States that will die from infant mortality that, if they were living in Scotland, may not suffer from this. So there are multiple different factors that can play into infant mortality, one of which being prenatal care, which we will speak about later. Prenatal care has been proven time and time again to prevent infant mortality. Also, income inequality is a huge issue with infant mortality, looking at the ability to receive treatment and be in an area where things such as safe sleeping practices and stuff is promoted and is common knowledge, where in other parts of the country it may not be as well understood. Also, the healthcare system can play a key role in this, as people are able to see primary care physicians, get that prenatal care from a physician as well. As you can see in this infographic that I have, the darker states are those that have higher rates of infant mortality, so more children dying before the age of 1. And you can see that Ohio right here is in the darkest shade of blue, therefore showing that this is a huge problem right here in our own state of Ohio and really should be something that is focused on. Many of the policy points that go along with infant mortality are more so focused on other aspects such as prenatal care and the healthcare system, and so I'll talk about those a little bit later. So now, on the other end of the spectrum is looking at life expectancy, so how long people are expected to live in a given country. In the United States, males live approximately 78.8 years, and women live 81.2 years. In Scotland, males live about 76.8 years, and women live 80.9 years. As you can see, there are not many differences between the United States and Scotland when comparing male to male and female to female. However, when you look at the comparison between men and women in both countries, you'll see that both of them have a noticeable difference between women and men. Women do tend to live longer in both of these countries, which can be due to a variety of factors, such as being more apt to seek medical attention, whether it be for behavioral health needs or for physical health needs, which I'll talk about a little bit later. So that's one of the really important differences between men and women. However, with the United States and Scotland, there's not a huge difference when comparing by gender. So there really isn't any main difference that causes this. Now we're going to skip to one thing that can be a part of life expectancy, and one of the things that can cause premature death is drug overdose. In the United States, more than 64,000 individuals in 2016 died to drug overdose. So this can include both prescription opioids and illicit drugs, and that is just an astronomical number. But when looking and comparing it down in a ratio, that is 1.98 per 10,000 people that will die from a drug overdose in the United States per year. When looking at Scotland's statistics, 867 people in 2016 died from a drug overdose. Looking at the statistic down to a ratio, 1.67 per 10,000 individuals will die from a drug overdose. What I found to be most interesting between these is that in both the United States and Scotland, they have seen more than double the drug overdose deaths in a decade, so spanning from 2006 to 2016, where this data was collected. So while they have very similar rates of drug overdose deaths, I think the most fascinating part is that they have doubled. And as many of you know, in Ohio, we do have our own heroin epidemic, which is very close to home and taking many, many more lives than it should. So I think both of these countries must focus on different policies that can prevent this, such as providing more resources for people that would like to become substance-free, also by making sure that the drugs that are able to reverse the effects of drug overdose are becoming available, more readily available for people wherever they may be. Now I'm going to talk a little bit about adults with diabetes. This is another condition that can shorten the lifespan. And for those of you that did not know, diabetes does have two different types. So the first type of diabetes is for an individual that is born with diabetes. Their body is no longer able to produce insulin, and insulin is used to absorb glucose. So insulin essentially helps control blood sugar in the body. Now type 2 diabetes over here can be onset later in life, either as a child or as an adult, but you are not born with it. So type 2 diabetes deals with cells that no longer are able to respond to insulin. When this happens, again, since the insulin is what absorbs glucose, the blood sugar is very sporadic and unstable. So this can be a huge issue for individuals. Often they need to be taken to the emergency room if it gets out of hand, or it can cause death. So in the United States, 29 million people do have diabetes, which equates to 9% of the population. This is a much larger percent than in Scotland, where only 4% of people do have diabetes. Looking at this, also in the United States, 86 million people have prediabetes, which shows those precursor symptoms to people that may develop diabetes, that type 2 diabetes. And so those people, if they're able to make lifestyle changes, they may be able to reduce their risk of developing diabetes. One of the leading causes of diabetes is obesity. So I think that one of the main things that the United States could benefit from is policy to focus on food disparities in places that don't have adequate access to healthy foods, which I'll talk about a little bit later. West Virginia has the largest rate of diabetes at 15%, which is huge compared to the average of the United States and especially to the average of Scotland. So I think it would be really important to focus on public health interventions in those communities in order to reduce the rate of individuals with diabetes. Now I'm going to move on to healthcare spending. So first we're going to look at total per capita that is spent. In the United States, $9,990 total per capita is spent each year. In Scotland, it is about $2,834. This difference can really be focused on what is covered and what is not. I'll talk a little bit later about preventative care and the difference between the cost in preventative care and emergency medicine. But one of the main factors that you can take away from this is that emergency medicine is much, much more expensive. So here, when the United States, we do have an issue where many, many people are visiting emergency rooms because they don't have primary care physicians that they can see either when something begins to be a problem, so it develops too far and they need to go to an emergency room, or they simply don't have a primary care physician to go to when they have minor illnesses and need help. So emergency medicine could be one of the reasons that this rate is so high. So I'll talk a little bit about care later that can be put in its place and that can really help reduce the amount of people that are visiting the emergency room and reduce the cost overall. Now looking at out-of-pocket healthcare spending, in the United States, about $338.1 billion were spent in 2015 to cover out-of-pocket costs for healthcare. In Scotland, only about 14.8% of total expenditure is on out-of-pocket healthcare spending. One of the differences is that Scotland has a universal healthcare system. Therefore, every citizen is able to have healthcare no matter what. This reduces the need for out-of-pocket spending by a ton, seeing as the only things that you would need to spend out of pocket are those that are elective services or additional fees. So that's one thing the United States is kind of moving towards, to make sure that everyone has insurance. But with Scotland's universal insurance plan, all insurance is paid by the taxpayers, and it makes it so that there is virtually no out-of-pocket spending. Now we're going to move on to healthcare systems, and as I spoke about infant mortality earlier and told you that one of the major preventative measures is prenatal care. So prenatal care is any of those screenings, testings done by a physician, or any vitamins prescribed or prescriptions, or any precautions taken in order to ensure a baby's health while still in the mother's womb. In the United States, 73.7% of pregnant women do get this prenatal care within their first trimester, which is the first 3 months of pregnancy. However, 6% do not get care until their last trimester, so the last 3 months of pregnancy, or they do not receive prenatal care at all. In Scotland, it's a different story, where 87% had an appointment at or before 12 weeks, so in the first trimester. This is different because in Scotland, all pregnant women do have the choice of prenatal screening. It has been found that prenatal screening can prevent a multitude of issues such as low birth weight children, premature children, and future health issues down the line. So I think one policy that could be enacted in the United States is providing that prenatal care for all pregnant women so that they can prevent these diseases and hopefully have a more healthy child. Now, as I talked about earlier with the emergency department visits, the United States does have more individuals visiting the emergency room per year. So each year, about 45.1 visits per 100 people in the United States, while in Scotland, only about 28.7% of their individuals will visit the emergency room. As I said earlier, the emergency room costs much more because it is for individuals that need immediate attention. So for individuals that are able to get primary care and have screenings, watch out for diseases, they will not necessarily need emergency room services as often. So I think one of the main policy points that can be enacted here is ensuring that every individual is able to see a primary care physician, one that is very well qualified, and they can receive quality service in order to prevent these diseases or these illnesses or injuries that will put them into the emergency department, which does cost a lot more. Now, with it being flu season, I would like to talk about flu vaccination rates for a bit. So there are some misconceptions. I will begin by saying that flu vaccinations do cause autism, which has been proven time and time again that the study that originally stated that had been fabricated and that it simply was not true. Also, people are afraid of getting the flu from the flu vaccine, which again is not possible and is something that many people believe, but it does not hold true. So those are some barriers that really could keep people from getting the flu vaccination. So in the United States, 59.3% of children do receive the flu vaccination each year, and 43.6% of adults receive the flu vaccination. In Scotland, 59.7% of people under the age of 65 receive this flu vaccination, and 76.6% of people over the age of 65 receive the vaccination. What's interesting about Scotland is that children aged 5 to 11 in school are able to receive their vaccination at school free of charge. Also, elderly individuals, children aged 2 to 5, pregnant women, individuals with long-term health care, unpaid carers, and those working in the healthcare field do receive flu vaccinations for free. So I think that it would be really important for the United States, in order to increase the amount of people that are getting the flu shot and to increase the amount of herd immunity, causing less people to get the flu each year, they really should institute these options that Scotland has chosen in order to vaccinate as many people as possible at a free or reduced rate. Now, moving on to another healthcare system, as I've already talked about prenatal care and infant mortality, one of the big things that is told to expectant mothers is that they should try breastfeeding. However, in order to promote and support pregnant women to breastfeed their children, both the United States and Scotland both take part in an initiative put on by the World Health Organization and UNICEF called the Baby Friendly Initiative. So at maternity hospitals, the staff there are told to encourage and support mothers as they go through the breastfeeding process. This Baby Friendly Initiative put out the 10 steps to successful breastfeeding, and it has been proven very successful in Scotland, raising the rate of individuals who breastfeed from 55% to 74%. I think it's great that both countries participate in a program like this and that more and more hospitals are able to provide that encouragement and support to women who are giving birth. Now I'm going to change my topic a little bit. We're going to be looking at public health prevention now. So as I'll say with all of these public health preventions, it's really important to look at this and realize that a lot of the focus is on those local level interventions. So first I'm going to look at STD prevention and control efforts. In the United States, the CDC puts out specific recommendations on how to prevent the spread of STDs. So they really recommend that there be school education programs from trained professionals and only providing age-appropriate information in order to reduce the risk of individuals contracting an STD. Again, there are a lot of local level initiatives going on. Equitas here in Columbus is a health center that provides a needle exchange so that individuals who may use drugs that are injected, they are able to provide them with clean needles. While obviously the hope would be that these people are going to stop doing drugs, we want to make sure that while they are still making that choice to do drugs, that they're doing it in a safe manner and that we do not increase the spread of STDs in our country. In the United States, 1 in 2 sexually active people will contract an STI by 25 years old. So I think it's really important to emphasize the local level programs that we do have that can work to further that foundation on how to prevent this disease. In Scotland, they have similar protocols and similar recommendations. There are a multitude of Scottish publications that focus on using theoretical models of behavior change, as well as using trained providers to deliver the information and the interventions. Now, one of the things that I'd like to focus on with the public health prevention is injury prevention. So injuries can happen anywhere, at work, at home, in hospitals even. So the CDC has put out some recommendations. I should have mentioned before, the CDC is the Center for Disease Control and Prevention. They have a plethora of knowledge about how to prevent diseases and really a lot of different information on the health effects that they may cause. So the CDC has recommendations on ways to prevent drug overdoses, motor vehicle safety, in order to prevent injury, domestic violence, and workplace injury as well. So one thing with the United States is I think it's great that the CDC has all of this information. However, I think there needs to be a lot more push to get this information out into the community and into the hands of the people, whether this be through community center intervention or an increase in teaching these topics in school. I think that that really needs to be integrated into the community. Scotland, there's also a focus on local level interventions, and they really have a focus on individual work practices and each company providing their own injury prevention strategies. Neither have major specific programs that on a federal level, which I think would be very helpful because a lot of these injuries could lead to deaths. So it's really important to focus on ways to prevent them and ways to get them before they even affect the people in our own communities. Also looking at public health prevention, I'd like to talk a little bit about chronic disease prevention. So chronic diseases are those diseases that you can't catch from someone else. You can't catch it like you can a common cold. So these are things like arthritis, diabetes, asthma, and in the United States, 45% of Americans do have at least one chronic disease. There are things like the National Center for Chronic Disease Prevention and Health Promotion, which tries to ensure that people are aware of the risk factors that can cause these chronic diseases. But there's also a lot of local and state level programming that does stem from it. There's mainly a focus on diabetes, heart disease, obesity, and associated risk factors, but there are a plethora of other chronic diseases that really should also take a forefront because they are taking too many lives. In Scotland, only about 25% of adults do have a long-term illness or chronic disease, and they have the healthcare quality improvement strategy, which really focuses on patient-centered care, safe, effective, efficient, and equitable care. So this is really something that the United States can employ, and I think both countries would really benefit from, again, more local level interventions getting into schools, community centers, hospitals, workplaces to really emphasize the importance of preventing yourself from getting one of these chronic diseases that can be very debilitating and can cause people to lose some sort of function and make their quality of life decrease. Now, lastly, talking about the accreditation of different health centers and of hospitals, the United States has the Joint Commission, which is a nonprofit and tax-exempt commission that sets standards for hospitals to ensure that they are going to be reimbursed by Medicare and Medicaid patients that use those programs. Scotland has a United Kingdom Accreditation Service, which is very similar to the Joint Commission of the United States. However, it covers all 4 of those countries in the United Kingdom, so Scotland, England, Wales, and Northern Ireland. They also have a focus on patient safety, which is something that I think the Joint Commission should really focus on, not only for safety from procedures and stuff, but we definitely need more of a focus on safety from contracting diseases in the hospital that we did not come in with. Now I'm going to switch gears a little bit to the physical environment. So fluoridated water. So fluoridation is the process of putting fluoride into the water, which often is associated with tooth decay and development and making sure that teeth remain healthy. In the United States, about 74.7% of our water is fluoridated, and that reaches out to about 212.2 million individuals. However, what I found to be very interesting is that in Scotland, none of the water is fluoridated. This has been a topic that they have tossed back and forth, but it's not one of the forefront pieces of information or legislation that they are trying to focus on. But I think it's really important that Scotland does take a hard look at this, as it has been proven that fluoride can be beneficial for tooth health, and it would be something to look at in order to possibly reduce some dental health care costs. Now looking also at the physical environment and water, we're now looking at water safety. In the United States, 89.3% of the nation's water systems are in compliance with EPA standards, which means that it's safe for individuals to be able to drink. Now I find this interesting that in Scotland, 97% of their water comes from the Scottish Water Company, which makes very clean water. So as many of us know, the Flint, Michigan water crisis has been a huge issue for the past few years, and as one of the main factors in the United States having a lower rate. So really focusing on getting that water safe and clean for people to drink is something that should be at the forefront of our minds. Now looking at limited or inadequate access to food. Many people live in food deserts, which means that they are more than a mile from fresh foods, or they're food insecure, where they do not know where their next meal is coming from. In the United States, it's 12.7% of people, and in Scotland, it is 8% of people. I think both countries should be charged with the goal of reducing that rate so that there is nobody going hungry. There's a lot of waste products, I'm sure, in both countries, and if we can figure out how to use that in order to feed our hungry people, I think that would be really beneficial. Now looking at children exposed to secondhand smoke. Secondhand smoke is that involuntary inhalation of smoke from individuals. It can be children or adults, but looking here at children, in the United States, 40% of children suffer from inhaling secondhand smoke. 7 in 10 black children are exposed to secondhand smoke. Now in Scotland, about 11% of children are exposed to secondhand smoke, which is down from 22% in 2014, which is a really big factor. I think that a lot of places could adapt things such as our Ohio State tobacco-free ban in order to ensure that people that do not want to inhale these tobacco products and this smoke are not faced with it. Now looking at access to care in uninsured adults, in the United States, 12.4% of adults ages 18 to 64 are uninsured. And again, that goes back to what I talked about with the emergency department usage being so high. A lot of these people do not have primary care physicians that can take care of problems when they arise, instead of allowing them to get worse and worse until they need emergency assistance. In Scotland, like I said, with a universal healthcare system, none of them have to worry about being uninsured. And as we can see, they did have a decrease in the amount of emergency room visits. They also have things such as lower infant mortality, which can stem from this insurance that they all have. Now looking at unmet behavioral health needs, in the United States, 80% of medical care costs and physical illness and disability medical assistance is covered by insurance, while only 50% of mental health needs are covered by insurance. There's a stigma around mental illness, and so there is a lot less reporting of mental illness, as well as there's no definite diagnosis, so it is more difficult to receive treatment. In Scotland, they conducted a study and found that 560 of 598 people responding to a survey said that there should be more structure and more accessibility to behavioral health assistance. So I think both the United States and Scotland can benefit from this information and move forward in a way to increase the amount of behavioral health centers around the country in order to help these people. Now looking at those that are underserved areas that do not have primary care physicians, both in the United States and Scotland, primary care physicians are more reluctant to go to poorer areas and because they do fear that they will not be reimbursed from Medicare and Medicaid, and therefore they do not want to provide services where they don't think they're going to be paid. So really focusing on ensuring that these doctors will be paid for their services and including some new policies would definitely help get them into those underserved areas where people really need them the most. Now I'm going to do some social and economic environment. So teen birth rates in the United States sit at 22.3 per 1,000 girls under the age of 20. And in Scotland, 44.6 girls under the age of 20 per 1,000 are becoming pregnant. Now these rates are very different, and it's very interesting to me because I think that sex education plays a large role in this. I believe that both countries do have a need for there to be more regulation on sex education throughout the country because right now there is none. And so we have been taught that abstinence-only education does not work and it is not beneficial to stopping teen pregnancy rates. So I really think that that is something that should be done away with and that we should be focusing on other ways to tell children about these issues. Now looking at unemployment rates, both in the United States and Scotland, they're very, very similar. The United States sitting at 4.7% of the population unemployed, and Scotland being 4.9% of the population. This all has to deal with the economic climate at the moment. As we look back at the recession in 2012, there was a huge issue with unemployment, and so this is always changing, really by focusing on ways to give people that need jobs here in their own communities. It's really important, and I think that both countries could be doing a better job of that. Now looking at violent crime rates between the two countries, violent crimes are described a little bit differently. United States defines it as either murder, non-negligent manslaughter, forcible rape, robbery, and aggravated assault, where Scotland only defines it violent crimes as murder and armed robbery. So as you can see, the United States has 386.3 offenses per 100 inhabitants, where Scotland has 11.68 offenses per 100,000 inhabitants. This is very interesting to look at. However, the comparison cannot be made because they do have very different definitions of violent crime rates. However, reducing violent crime rates in general would be great, and by having more laws and rehabilitation programs for people so that they're not just going to jail and coming back and doing the same thing. Now the last thing I'd like to talk about is child and adult poverty rates. The United States and Scotland have very similar poverty rates. So children in the United States, about 21% of them are in poverty, while in Scotland about 17% are. And 13.5% of adults in the United States suffer from poverty, while in Scotland there are 14% of them. Both could be working to lessen the poverty rates by increasing areas for jobs and by helping these people get out of poverty. So in conclusion, I just wanted to share with you a couple of the differences that there are. So in the United States, there is fluoridation in the water, while in Scotland there is no fluoridation. I thought that was really one of the most interesting things. Some similarities are they both participate in the Baby Friendly Initiative. So as you can see throughout the presentation, looking at violent crime rates, teen pregnancies, there are really a lot of differences and similarities in the United States and Scotland, and I really think that both countries could learn from each other and take different parts of their healthcare systems in order to improve their own. Thank you, and if you have any questions, please do not hesitate to begin a discussion with me. Thank you.